Hi, so we're with Socks today, and she came in with her owner telling me that she was doing some chattering with her mouth, so she was a bit concerned about some teeth. So we've had a look, and she definitely does have some issues with her teeth. And I think this is something that people can easily have a wee look at. So we've just opened her mouth there, and you can actually see there's a big chunk of tartar on that tooth, even on that other side. She's got the same, a huge big chunk of tartar, and that's moving. The other thing with her is even her fang tooth, good girl sweet, that's all red above the gum, and when I swing on that wee fang tooth, that's sore as well. So she's going to need at least those 3 teeth out, so we're going to get on and do that now, and we'll let you know what we find. So here we are with Socks, and first of all, this fang tooth, if you look at the bulge up here above the fang, you can see that's really quite red and swollen, so that's suspecting there's a problem with that fang. And if you can actually wriggle it, then we know we've definitely got a loose tooth there. That will have to come out. Looking at this big carnassial back here, that's got a heap of tartar on, and you can actually wriggle that as well. And she's got the same issue on the other side with the carnassial as well. So we're just going to whip them out, and we'll show you how it looks after. So that took all of 2 seconds just to pull that tooth out. Honestly, it wasn't really holding in by much, the one at the back. It's already starting to heal around the root. There's a big hole there, but that's all fill in nicely, and that's where the fang tooth was. So that's looking really great, and the bottom teeth are pretty good. We've just done a wee quick clean. Alright, on to the other side. On the other side, you can see that top carnassial tooth is just covered in tartar, but the fang tooth's looking pretty good. It's not bulging like the other side. There's not a lot of tartar really, except for that carnassial, and that's quite a common tooth to get tartar on. And then it's obviously caused an infection, and then that's loose. So we'll just pop that one out too, and we'll show you how that looks. Okay, so there's the other tooth out. That pretty much was only holding on by one root, so I could just grab hold of it, slightly twist it, and out it come. So that's really good. So she'll be feeling a lot happier when she wakes up. Those teeth were really quite smelly, so that's the other key, is you can actually smell their breath, and you might pick up that things are rotten in there. And if we have a quick look at the teeth, like there's no redness as in, you know, any healthy tissue at all on that tooth. Sometimes I say at the root, if it's held in, you'll see some redness, a wee bit like the end of that root. But really, most of that root had receded all the way back, and it was just hanging on by the tip, and that's why it was loose. That one wasn't even holding on by anything, it was just stuck in the back of its mouth, so that's what it would have been doing, the chattering, trying to eat with that. And cats are amazing, they still eat even though they've got rotten teeth, so it's really pertinent that the owners have a look in their mouths, or at least get a yearly vet check to check that their teeth are okay. And Socks will be up and away soon and feeling a lot better for it. Thanks for watching.